Do you ever feel tired, sluggish, have brain fog, or have anxiety? One might think that you're overworked or it's from a lack of sleep. You would be right on both accounts. But it could be something inside your body that you never thought about. Hashimoto's disease has the same symptoms but causes more harm to a person's body. When my daughter and I were diagnosed 2 years ago, I started looking for more information to inform myself about the disease. After reading books, medical journals, and research online, I'm going to inform you just how someone gets this disease, how it affects the body, and how it is treated. To start, let's look at how someone can get Hashimoto's disease and where it starts in the body. What is Hashimoto's and how does a person get this disease? It's an autoimmune disorder that has symptoms like fatigue, muscle weaknesses, depression, weight gain, and swelling of the thyroid, which is where the Hashimoto starts in the body. The thyroid produces hormones that are known for controlling different parts of your body. When someone gets Hashimoto's, it causes great harm to the thyroid gland. According to the Mayo Clinic, Hashimoto's attacks healthy tissues, which can lead to the death of the thyroid gland and would stop the production of hormones for the body. So who can get Hashimoto's disease, and why do they get it? The most common people that have Hashimoto's disease are women. There are several reasons why they get this disease. According to the National Library of Medicine, women are often affected 10 to 1 over men. Most women are diagnosed at age 30 to 50, but children as young as 6 have been diagnosed. What causes someone to get Hashimoto's disease are hypothyroidism and a deficient dietary intake of iodine. We just looked at how someone gets Hashimoto's, so now let's look at how the disease affects a person's body. People who have Hashimoto's show an array of symptoms and the disease penetrates the thyroid. When a person is having symptoms, the doctors cannot always detect the disease quickly. Once a person starts showing signs, there are numerous tests done to try and find the problem. This can take months or even years to find, with many tests coming back negative and saying that nothing is wrong. According to registered dietitian Julie Kuba, she witnessed through her patients how hard it was to diagnose Hashimoto's, but did not realize how hard it was until she was going through the same experience herself and was told nothing was wrong with her. Hashimoto's destroys many things within a person's body that is regulated around the thyroid. According to the Mayo Clinic, there are many ways that Hashimoto's affects the organ system of one's body, including fatigue, weight gain, skin conditions, enlargement of the thyroid, and heart problems. It is also related to other diseases such as anemia, adrenal insufficiency, and celiac disease. We have learned how someone gets Hashimoto's and how it affects a person's body. But how is this disease treated? After numerous experiments, researchers have found effective medication to treat the symptoms of Hashimoto's, for there is no cure. The most common treatment for patients' symptoms with Hashimoto's is prescribed medications. According to the National Library of Medicine, Hashimoto's disease treats for symptoms with a hormone called levothyroxine or synthroid. Levothyroxine or synthroid is taken in when you get up before you eat with a full glass of water. There are other treatments for the symptoms, including a nutritional diet, reducing stress, plenty of sleep, and supplements like zinc, magnesium, and fish oil. As you can see, someone that has Hashimoto's goes through a lot once the disease is detected. First, someone gets Hashimoto's from having hypothyroidism or deficiency dietary intake of iodine. Next, Hashimoto's affects the thyroid and causes heart problems, anemia, and celiac disease. And lastly, the person takes medication for the symptoms, since there is no cure for Hashimoto's, including levothyroxine or synthroid, along with supplements and plenty of rest. After learning more about Hashimoto's disease, one can determine that there is more going on inside the body than meets the eye. Thank you.